Hi, my name is Sam Takvorian, and I'm an instructor in the Division of Hematology and Oncology at University of Pennsylvania. I first want to thank Dr. Schulman and the conference organizers for inviting me to participate in today's workshop. I'm especially grateful that they decided to conduct this workshop virtually, given its heightened importance in the time of COVID. I was asked to share with you a patient-facing digital health application, and thus we'll introduce you to an ongoing care delivery experiment that we have at Penn that we refer to as Penny, a digital health approach supporting symptom management and medication adherence in oncology. I have no relevant financial relationships to disclose. I did want to mention that University of Pennsylvania may receive royalties in connection with products developed by our industry partners. To contextualize the problem that we are trying to solve, I first wanted to highlight a few trends in the cancer care delivery landscape. First, there is an increasing ambulatory focus to everything that we do, and more recently, care has shifted even from the ambulatory or office-based setting to the at-home setting. Second, with the dawn of personalized medicine, there has been a dramatic rise in the availability and use of oral anti-cancer agents. These first two trends are of net benefit to our patients who are spending less time in our office and in our infusion suites and more time at home and with loved ones. But it also implies that they're bearing more of the responsibility for side effect monitoring, symptom management, and medication adherence. And finally, there is a system-wide trend towards capacity strain and myriad financial and workforce pressures to improve the efficiency with which we deliver cancer care. Stemming from this context, we at Penn, when considering our digital health strategy in oncology, asked ourselves several questions. How can we leverage digital health to improve care efficiency and patient outcomes in oncology? How can we harness resulting patient-generated data to drive a learning health system that continually improves? And how can we empower and/or nudge patients toward higher value evidence-based behaviors? And we settled on the following use case, that of oral anti-cancer agent adherence and symptom management support. We conducted contextual inquiry, interviewing patients with solid malignancies who were admitted for poorly controlled symptoms. And we learned that patients want to be engaged outside of office visits, that they are accepting of mobile phone-based means of engagement, and they prefer asynchronous text messaging to apps or telephone calls. We then engaged triage nurses and other frontline providers and developed consensus-based symptom management pathways. We baked all of this learning from our contextual inquiry into the platform that we refer to as Penny, which we think represents a new paradigm for remote monitoring of oncology patients. Penny is an artificial intelligence-enabled bidirectional conversational agent, commonly referred to as a chatbot, whose capabilities include patient-reported outcome-based symptom monitoring with self-management support and real-time adherence instructions and motivational reminders and feedback. Penny integrates seamlessly within our EHR to enable communication and longitudinal monitoring between patients and their clinicians. Penny is truly a virtual care team member that is an extension of the physical team who is available at all times to help patients who are initiating and who are ongoing on complex oral anti-cancer agent regimens. Natural language processing capabilities enables bidirectional communication that mimics a human feel and is conversational in nature, as you can see. Penny also provides step-by-step personalized guidance to support adherence behavior. And embedded in the text chain are real-time dosing instructions, as I'm demonstrating here. Finally, an adaptive rules engine based on the symptom management pathways that I referenced earlier enables Penny to monitor and to respond to symptoms that are reported by patients. Patients are both asked to report their symptoms and also have the ability to report their symptoms at any time and in any way that they would like. Penny will iterate with a patient such that we can categorize the symptoms that they are reporting within the familiar lexicon of the PRO version of the CTCAE. If a patient reports low-grade symptoms, based on the symptom management pathways, they may be guided through various self-management strategies. If a patient reports higher-grade symptoms, that report will be triaged to the appropriate care team member. We conducted a 6-month usability study enrolling 10 patients who agreed to participate. We conducted structured qualitative interviews at monthly intervals to evaluate the feasibility and acceptability of this intervention, and overall noted high participant satisfaction and high fidelity and reliability across a combined 85 participant months with accurate grading and triaging of side effects. Penny worked in this small pilot study to improve medication adherence, to substantially reduce the call volume, and also, at least preliminarily, led to avoidance of ED visits. I've shared one quote from a participant here. When you are in the moment feeling sick, you aren't thinking straight, Penny is that straight thinker we needed at those times. These are just some early results from our use of this particular patient-facing digital health application. And in preliminary testing, I've shown that Penny was a feasible and acceptable means of supporting symptom management and medication adherence. Reduced call volume and improved provider triage demonstrate the potential efficiency gains from this type of digital health application. We have an ongoing phase 1 study to assess more rigorously safety and reliability across expanded cohorts, and also plan to begin enrolling a randomized phase 2 controlled efficacy trial and mixed methods evaluation of Penny to begin this fall. Thank you for the opportunity to share with you this particular application. I look forward to answering your questions.